Sexual asphyxia, the silent features, reasons. Oxygen deprivation of the brain is thought to lead to an enhancement of sexual orgasm. Sexual orgasm for following reasons: decreased oxygen, oxygenation, and carbon dioxide retention produces feeling of giddiness, lightheadedness, and exhilaration, and which heighten the sexual responses. Induction of erotic hallucinations. Similar conditions have been observed in deep sea divers, who have reported giddiness and high due to carbon dioxide retention. Partial asphyxia. Partial asphyxia brings about increased sympathetic arousal, which in turn heightens orgasmic pleasure. Although male erection is associated with the parasympathetic arousal, orgasm is under sympathetic control. Okay, this male erection is due to associated with the parasympathetic. Orgasm is under sympathetic control. Female erection and orgasm are similarly mediated methods. Partial hanging, a variant of suspension bondage, most common method. Neck is protected by a padding, usually a towel between the neck and ligature. Ligature is passed around the neck in the form of a running noose. It's free and tied to a limb. It's tied to a limb. You understand? Ligature is passed around the neck in the form of a running noose. It's free and tied to a limb. Restore angles. Or to a fixed object. Weight of the body is used to control the pressure. Associated paraphilias are also there. That is masochism and transvestism. Subject ties upper wrist, ties up wrist, and angles together with a chain, a padlock, a rope, a string, or wire. Sometimes noose is found around the waist and genitalia. May have blindfolded himself. Evidence of self-mutilation also there. Self-mutilation. On previous occasion, burns, cuts, puncture, wounds, etc. on the body. Clamps or pincers attached to the genitalia or breast region, and genitalia may have the puncture wounds on the clamps and pincers attached to the genitalia. Transvestism found dressed up as a female with bra, cuts, puncture wound, etc. Clamps or pincers attached to the genitalia. And bra may have been found padded up to stimulate female breast, sometimes even sanitary pad. Wigs or makeup may be worn. Sometimes found naked or partially naked with the penis exposed through pants indicates penis was being manipulated. Erotic or pornographic literature or female nude photograph may on the floor or elsewhere within a view. Evidence of a recent emission of semen. There may be mirror in front. Mirror may be in front to watch the activities. A video camera may be there to photograph, photographic record. Mechanism of accidental death. If the noose touches the carotid sinuses, consciousness is suddenly lost, and the victim is incompletely suspended with the legs on the ground. He may be found suspended close to an object such as a hair or stool, that would have allowed him to sit upon or release the vasoconstriction and achieve the orgasms. Evidence of previous episodes on the neck, that is on the old scars. Other methods involving evolving asphyxia, that is chest compression or inhalation of chemicals such as amyl nitrate, pain, carbon tetrachloride, cocaine, chloroform, ether, ethylene chloride, glue, ketamine, nitrous oxide, paint, thinners, propane, trichloroethylene, or walnut amyl nitrate. A pad soaked with a sniffing chemical may be found nearby. Plastic bags make mask or impervious bags over the face. They are secured around the neck by an elastic or ligature to keep them placed. The interior of a bag smeared with any of the following chemicals. Submerging underwater, that is aqua eroticum, a combination of several of these methods. Non-asphyxial method, that is electrical stimulation. Electrolytes are applied to the genitals or abdominal wall, usually with a low voltage supply from battery transformer. Why it is an accident hanging? Death is not intended by the victim, but it usually results accidentally when the safety mechanism employed by the deceased fail or when there is an overdose of chemical inhalation. Sometimes the subject goes to extreme lengths in choice of contraception used. A 19-year-old male used a pressure suit for military jet pilot to compress his thorax and inflated with a 12-volt compressor. Additionally, head was covered with a mask and motorcycle helmet. The cause of death was massive compression of the thorax. Okay. Incidence is more common in Western countries, and males, sex ratio males are more common. 50 to 1 is the ratio. Scene of death following all protocols of scene of death investigation. Following points are important. Evidence of abnormal sexual behavior, masochism, transvestism, evidence of previous occurrence of similar events. That is grooves in the rafter, and also rafter or ropes, verbal communication with the friends regarding the nature of the activities. Evidence of surfing net with the sides related to sexual hanging diaries. Evidence of to protect neck padding underneath the luggage. No motive or other evidence of suicide. Similar activities like a choking game. That is medical differentiated from suicide. Insurance policies. There is a clause stating that no money would be paid in case of suicide. Differentiating is not always easy, especially when a strong reason for suicide appears to be coexisting. In some cases, family members are all embraced that they are reluctant or unwilling to provide through enough data surrounding the circumstances in which the patient was found. The cause of death may be mislabeled as a suicide. Case studies: a 30-year-old male was hanged in the living room of his flat. Scene matched imperfectly with that of a typical autoerotic death, with the deceased facing computer screen, where the video of an unclothed female could be seen. His left hand was inside his trousers in the genital area. The autopsy, however, showed advanced sarcoidosis, which was known to the victim and which could be the reason for the possible suicide. Next is a 35-year-old man was hanging in a relatively isolated place outdoors. At a first glimpse, it is looked like a case of autoerotic asphyxia. A vest was wrapped over his head, neck, and lower part of the face. Hands were loosely tied in the form of body. The vest was tucked between the neck and ligature to act as a part. However, through thorough scene examination and postmortem examination excluded any evidence of foul play. It was found to be a case of a suicide. Thank you.